Okay, so the last 2 Sundays, we've been looking at options on how we should be able to be restoring our health back to normal. On the first day, just to recap, we went through the 5 areas that we look at when we are restoring our health back to normal, and that was nutrition, toxicities, balancing your hormones, your mind, and your body. So the 5 areas that you look at. And on the last Sunday, we actually looked at how we could use nutrition and the right nutrition to ensure that we don't get sick, our bodies do well, and we are in a position to actually go out and have a good, healthy life going forward. Now, today, we are looking at the second important pillar post the nutrition. Today, we are looking at how we need to detox ourselves and why is it so important to detox ourselves. So I have this presentation that would be about 15 minutes to an hour, and then I'll have open question answers for you. But right through, like last 2 Sundays, I would like, or last 2 sessions that I've had with you, I would like you to participate. And when I ask you to type in the chat, I need you to type in the chat. So please cooperate. Let's have some good learning and sharing, and understand how we can make the best use of what I have to offer you to restore your health. Having said this, let's get started. Yeah, so the very first thing that actually struck me, and this was a very old paper when I just started my clinical practice in this area of functional medicine, and this was a paper that I kept cutting, that I kept with me. It was Times of India way back in 2005, and the first 2 paragraphs, or 3 paragraphs, if you look at, 17-year-old army recruit undergoes bypass surgery. His cholesterol level was normal, but he had deposits in his arteries. A 22-year-old complains of chest pain. Test reveals heart condition. He undergoes a bypass. A 36-year-old dental surgeon undergoes a second bypass surgery. A stressed out 16-year-old boy has a heart attack. Now, these were some of the articles that I had back then. I've stopped collecting. I have a lot more that I could have kept putting out here. But what is actually happening? Heart disease, bypass surgeries, angioplasties were meant for old people. Why are the young getting it? Could there be something deeper that's happening because of the environment around us? And yes, if we look at what are the factors that interact or influence health and disease, you will see that everything in the environment affects us. Disease and outcomes are as a result of the number of pathways that exist between our environment and our body. So depending on what you are exposed to, you will have healthy outcomes or healthy aging or disease. And the contributors or opportunities or the reasons why you get sick could be anything from chemical and toxic metals to the kind of energy affecting your body, to disease, the stress, to the environment around you, to the nutrients that you consume, to how your socioeconomic status is and how you live within your family, to finally whether you will get dementia, you will get disease, or you will be aging healthily, or what your growth and development will be, and how resilient your body will be, or how vulnerable your body will be, as we can see today. I was just looking at the latest reading on the numbers that we are having worldwide from 2 doctors in California. And they were talking to us how we are going to be very vulnerable because our immune systems are still further going to be lowered or less sturdy going forward, because we have not been able to actually take care of our immune systems the way we should. And that is one of the reasons why the current virus is having a gay time all over the world. It's playing havoc with our bodies, yeah? So a lot of contributory factors, a lot of contributors, a lot of opportunities for us to actually go back and reverse this disease. Because if you actually work on this contributor, then we'll see through this presentation how we can, you will be able to actually knock off disease, reverse disease, and live a healthy life. So when you look at environmental chronic disease, you see how environment actually affects the kind of chronic disease that you're going to get. What are the environmental factors that affect you? Let's look at them. You have your food. We spoke of it last time. The kind of diet that you have, the kind of fossil fuels you are using, the situation, your socioeconomic stress that you always carry with you. One reason why today we are locked down and we are still stressing. I thought this was a good time for all of us to rest, to relax, and to recoup and to give our bodies some well-needed rest so that we can get out there and start on a good note when things kind of open up. The chemical and the toxic metals that you get in your food, your water, and everything that else that you do, your environment around you, the way you have your transportation, which is creating so much of pollution, then how do these factors affect chronic disease? You have certain pathways, and these pathways generally are altered, and therefore you're getting this disease. So what are the altered pathways that affect and make you have this disease? One, of course, is inflammation, and we'll see what inflammation is. Second is disrupted insulin signaling, and I'll also teach you about what this is, because this may sound very technical, but it isn't. I'm going to show you how normal things that you do on a day-to-day basis affects the way your insulin behaves, and therefore the way your outcomes of disease or outcomes of health behave. And then, of course, the oxidative stress. And this oxidative stress as well also is a pathway that affects the outcome of your health and the kind of disease that you will have. And what is the disease that you normally see? You see everything from diabetes, obesity, abnormal lipids are generally what you see in the form of your cholesterol reports, but we look at the long reports. We need to look at the right ones. And I will try and touch that. I'm not sure if I have a slide on that. But if I don't, at the end of the session, please ask me a question on what we need to look at when we look at our cholesterol reports. And then something that is known as the metabolic syndrome. I'm not sure how many of you know what is metabolic syndrome, but this is playing havoc with our health status at this point in time. And of course, the most dreaded cardiovascular disease of all, which is probably the biggest killer on earth at this moment, not the COVID virus, by the way. The biggest surprise to all of you, and it was a surprise to me as well, was the immune system that we talk of so much, which is responsible for us actually, or a depressed immune system, which is responsible for this virus attack, the COVID-19, actually affects only 5% of the population. And that's what I was just looking at. And my dear friends, do you know the people who suffer from cardiovascular disorders or diabetes, or what we call the cardiometabolic spectrum of disorders, which is also due to your bad immune systems? 33%. We are willing to take care of our immune system to fight a virus, but we don't realize that if we don't take care of the immune system, we are still going to be prone to have the same cardiovascular disease. The inflammation that we talk of affects this immune system, yeah? And finally, the two other diseases of the elderly that you see much earlier today. I see so many patients today who have Parkinson's and Alzheimer's much earlier. And if you have diabetes and it is uncontrolled, please understand, Alzheimer's is nothing but stage 3 diabetes. So if you really want to live a good life, if you want to live a healthy life, if you want to be happy, cheerful, and live till the very end the way you want to live, life king size, like I say, then you need to understand that you need to reverse disease. You need to understand first what causes it, and then how we can stop those factors that cause this chronic disease. Because all chronic disease is generally caused by environmental factors. Yeah. Having said this, let's look at some other. So to start with, let's look at what this metabolic syndrome and insulin resistance is. Though this was meant to be a medical slide, I'm going to actually decipher this for you so that you understand what it is, and therefore this forms the basis of you understanding how you can reverse your own disease or how you can restore your health back to normal. Now, what is it that causes metabolic syndrome? Or what is it that causes, okay, so what is insulin resistance? Basically, we eat food. All the food that we eat has to be converted into what we call energy. This energy needs to get into our cells. So that's the reason why we eat food. Now, for this energy to get into our cells, the carbohydrates are converted into glucose, and the glucose is then through various biochemical reactions converted into the energy in the form of ATP. Now, when you do not have proper insulin response to the glucose that is formed in your body, then you have what is known as insulin resistance, which means that you have high insulin and you have high glucose. So you either get diabetic, or you have a pre-diabetic syndrome, or you have a metabolic syndrome. Now, this results in a whole lot of things, and we'll see what it results in, and I will explain this to you. But what causes this in the first place? The number one thing that affects this is stress. Mental stress is the number one factor. Number two, your sedentary lifestyle. Because when you exercise, your insulin gets sensitive to the glucose that you get in through your food. So you need to have a good amount of exercise every day. Now, when I say exercise, I've actually spoken about this in a number of my videos where I speak about what we call interval training. Now, interval training is a way that you can exercise which actually sensitizes your insulin to the glucose that you get in. So this is the number one thing that you can do. So sedentary lifestyle is the second reason why you actually get insulin resistance, which leads to metabolic syndrome. The third is a high calorie diet. So if you have high sugars, if you have lots of carbohydrates, it will cause you insulin resistance. The fourth is a high fat diet. Now, what I mean by a high fat diet here, there are two kinds of fats. You have the good fats and the bad fats. The bad fats are the current oils that you use from the market. The current oils that you use from the market are nothing but hydrogenated vegetable oils or refined oils. These are nothing but absolute trans fatty acids. When you consume too much of trans fatty acids, you do get insulin resistance as well. Then you have toxicity, and I will show you what toxicity you're going to have. All kinds of toxicities, toxins that we get into our body through the food, through the way we prepare our food, and through the way we store our food. And we'll understand this a little later. Then you have all kinds of other inflammatory disorders that do affect you, and that also causes insulin resistance. And finally, hormones, everything from stress hormones to a hormone imbalance due to the process of various reasons. It could be anything from sedentary lifestyle to everything that affects the hormones also affects insulin, because in our bodies, the hormone acts, all the hormones that actually regulate our body functions act like a symphony. So any one of them is affected, all of them go out of sync. So when you have any one of your hormones, even the sleep hormone of melatonin going out of sync, you will have insulin resistance coming in. You don't sleep properly in the night because you want to watch your TV, or you're on your comp, or you're on your mobile phone. It affects melatonin because the blue light affects melatonin. That itself causes insulin resistance. So a lot of factors that influence insulin sensitivity and resistance, leading to metabolic syndrome. Now, what happens here is, if you have high insulin resistance and that causes metabolic syndrome, what it does is, because the insulin is high, it causes a lot of your glucose to get converted into fat. And this fat accumulates around your abdominal area and around the organs. And this is dangerous. And this also further causes what is known as endothelial dysfunction, again caused by insulin. Now, what is endothelial dysfunction? Endothelial dysfunction is the functioning of the inner lining of your arteries. When that gets affected, you have the plaque formation or the blocks that finally lead to heart disease. So you see how everything is all interconnected. If you have high insulin resistance, you are going to get heart disease. If you have high insulin resistance, you're going to suffer from obesity. If you have obesity, it will further damage your cardiovascular system, causing further deterioration of your of the disease that you're already which is already setting in. So it's all interconnected. Can you understand this? So you need to understand where it starts. It starts from the causes that we just spoke of. And finally, what are the consequences of this entire conundrum that we get ourselves into? Everything from high blood glucose, that's sugar, and you get diabetes, you have high triglycerides, low HDL, which is a sign that you are getting heart disease. Then you have hypertension, which is blood pressure. You start getting depression because of your weight and other issues. You start getting thrombosis because of the endothelial dysfunction that I just spoke to you about. Thrombosis is basically nothing but your arteries start blocking. Then you have kidney dysfunction, nephropathy. You have neuropathies that is pain in your joints because the nerves are dying because of diabetes and other things. Cardiovascular disease we spoke of. Atherosclerosis is nothing but hardening of your arteries. We spoke of diabetes, type 2 diabetes. Then you have fatty liver. Fatty liver is as bad as alcoholic liver because the pathway by which they go is the same. The next stage is hepatitis and finally cirrhosis. So whether you drink alcohol or you eat a lot of carbohydrates, your livers are going to get hit. So this is one dangerous area because fatty liver we still do not have a solution to. Then you have PCOD, which is normally seen in young women. That is polycystic ovarian syndrome, which is an untreatable condition practically. Abdominal obesity, which has today created a multi-billion-dollar industry for weight loss. Please understand, if you do not have insulin sensitivity, you will never lose your abdominal obesity, whatever exercise, whatever solution that you buy and pay those huge dollars that you pay for internationally online. Then, of course, the most important is infertility and erectile dysfunction, which is another huge area today. And then you have cancer. You thought cancer was something different. No, it all stems from here. It stems from your metabolism. Cancer is a metabolic disease. It starts from here. You sow the seeds over here. And then, of course, you have things like kidney failure, which we spoke of, migraines, and something known as tinnitus. I don't know how many of you know what tinnitus is. Tinnitus is when your ear starts giving you a sound all the time and you can't do a bloody shit about it. Yeah, so these are some of the consequences of this entire conundrum that we get ourselves into, primarily because of what we eat, how we eat, and our lifestyles. So what are the toxic chemicals that actually affect us and alter the pathways which actually cause environmental factors to cause the chronic disease? One, from the air pollution itself, you get a lot of stuff, including lead and cadmium. There are other heavy metals like mercury, arsenic that also get into your body through pesticides. And then, of course, you have bisphenols and endocrine disruptors. What are endocrine disruptors? I just told you that any hormone gets out of sync, your insulin gets out of sync. Your insulin gets out of sync, there's altered insulin signaling. Altered insulin signaling leads to chronic disease. So if you have any endocrine disruptor that goes and stops an endocrine organ, what is an endocrine organ? Endocrine organ is an organ that secretes that hormone. So let's say thyroid. Thyroid gland secretes the thyroid. If you have any endocrine disruptor that will go and stop the action of thyroid, you are definitely going to have a whole lot of chronic disease setting in because you start with an early thyroid dysfunction that sets in. So the endocrine disruptors are dangerous chemicals that are present in our foods. They are also present in cooking utensils. They're also present in storage, food storage articles that we use. And this is how it enters our food cycle and into our bodies and does cause the problems that it does. Yeah. So far, if you have understood, I'd like to see some yeses in the chat box, please. Can we have some yeses in the chat box? Thank you, thank you, thank you so much. Thank you so much for having actually put these, for the responses that I'm having. Now, let us look at the Western disease cluster, and this has been well researched, and I have actually put down for you where I have picked up all these data from. I mean, these are stats that I have picked up, and it's all there in public domain. I've shown you from where I picked them up. You can see it in fine print there. In the West, 2/3 of US adults over the age of 25 years have double the prevalence of obesity or overweight. More than 2/3 of them are obese or overweight. 40% of the US adults are pre-diabetic and or have prevalence of diabetes when they cross 20 years of life. Cardiovascular disease is still the leading cause of death in the West, so is hypertension, always increasing. Metabolic syndrome, also you see about 35% of the adults having this. It increases as you cross 60, it's about 55%. So can you imagine this? And more than half of all elderly people above the age of 84 are suffering from Alzheimer's. That's about 5.3 million people suffering from Alzheimer's in the West. All this could have been certainly avoided if we knew how to reverse disease early and restore health early. Now, I've shown you the Western numbers. In India, which is one of the poorer countries, the situation is far worse. I picked up these studies these numbers from a study that was published, or the paper that was published in the Journal of Cardiovascular Disease in 2012 by an Indian author by the name of D.S. Prasad. And he says that in the poorest state of India, which is Orissa, the overall prevalence rates of metabolic syndrome is 33.5%. And this is divided into 24%, that means, or 25% practically, 24.9%. That practically 1 in every 4 males, and 42.3%, that is practically half of all females, suffer from metabolic syndrome. And this is a huge, huge, huge health problem across India because it is going to cause problems going forward. Countrywide prevalence of metabolic syndrome in millions has been mentioned over here. This is for diabetics. This was a 2013 number. Of course, it has gone up after that. You can see after China, India has the largest number of diabetics in the world. Why is this happening? Yeah. So what happens basically is your problems don't start in your adulthood. They start with the exposure to oxidative stress while you're still in your mother's womb. This results in low birth weight, which then as you progress, depending on the kind of food your mother has eaten, you are prone to obesity, hypertension, cardiovascular disease, diabetes, and then further go on to become Alzheimer's or a dementia or a Parkinson's patient. So aging practically begins at conception. But having said this, because you already have this problem, can it be changed? Yes, it can, because each of these diseases also have what is known as a genetic marker, or what we call SNP, that is a single nucleotide polymorphism, which means that a particular gene that has developed when you were as a child, which will give rise to this disease. But because you have that gene, are you 100% going to get that disease? No, because this gene still needs to be switched on. It needs to be switched on like we switch on the light, the switch, to get the bulb on in our rooms. So you need that switch to come on. And for that switch to come on, you need what is known as epigenome. And what is epigenome? Epigenome is nothing but the entire environment around you. So it's the environment that switches on that gene, which will then cause that polymorphism or the single nucleotide polymorphism or the gene that has developed when you were in your mother's womb to switch on or off. And most important of these epigenetic factors is one, like I told you last time, your nutrition. Number two, the toxicities that you get into your body. Number three, the state of your mind. And number four, the environment around you, your family, your society. So these are some of the major epigenetic factors that affect these genes that will give rise to your lifestyle disorders that are clubbed as lifestyle disorders now, but they are actually not lifestyle disorders. They are actually disorders which can be nipped to a bud if we understand what the cause of these diabetic disorders or what these lifestyle disorders are. Yeah. Have we got this? Can we have a few yeses in the chat box, please? Are you understanding what I'm saying? Yeah. Let me see. I just got. Yeah. Thank you. Thank you. Lovely. Lovely. Thank you. Thank you. Thank you. Thank you. Okay. So we come back to the same slide that I started with practically, that you have a whole lot of factors that contribute to your disease process, but it all starts with your environment that runs around you. So everything that you see at the bottom of this tree is a part of that environment, okay? So what are the mechanisms of actions that drive chronic disease? It's inflammation, it's disrupted insulin signaling, and it's oxidative stress. Now, why is inflammation so important today? See, when I was in my pathology about 30 years ago or 32 years ago when I did pathology, the classical definition of inflammation was color, dolor, rubor, tumor. That means heat, pain, redness, and swelling. This is what we used to call inflammation. But my dear friends, today we doctors, specifically looking at heart disease, diabetes, and other chronic disorders like even cancer, we look at a number. And the number is something known as high sensitivity C-reactive protein or C-reactive protein. What does C-reactive protein tell us? C-reactive protein tells us the inflammation within your body. High sensitivity C-reactive protein tells us the inflammation within your artery. Today we know atherosclerosis is an inflammatory disease, period. You need to understand this. So if this is an inflammatory period, what is it, inflammatory disease, what is it that puts down this inflammation? What is it that kind of brings this inflammation down? There's only one. You need to understand why inflammation actually gets started in the first place. Go to the root cause, get the root cause out, and then get rid of the inflammation. Don't take medications which will just dampen the inflammation. Because the day you stop taking the medications, the causes will continue causing that inflammation. So it's a continuous process if you don't go and stop the cause of this inflammation. Are we getting this so far? Yeah? Can you type a few yeses if you've understood this concept of inflammation? Thank you. Now, let's look at insulin signaling. See, when you have normal insulin signaling, your blood sugar is normal, you don't have any arterial disease, and your triglycerides are generally hovering around the normal figure. They're not very high, they're around the normal or even less, okay? So you don't have any of these going haywire. Now, when your insulin signaling is affected, right, it goes and causes two things to happen. One, it causes oxidative stress and it causes inflammation. We just saw how inflammation drives chronic disease. When this happens, you have blood sugar going up, you have arteries getting atherosclerosis, and plaque formation gets started, which leads to heart disease and other arterial blockages. And you have your triglycerides going up. So now you're falling in that category of a metabolic syndrome patient, because you've already got 3 of these criteria already filled up just by the insulin signaling getting disrupted. We shall see how this insulin signaling gets disrupted. We shall see that, right? So the first reason why your insulin gets disrupted is your food, diet, nutrition. We dealt a good amount of time on this topic last week, but I'm still going to show you some of these things which may help you understand why food and nutrition that you have affects the insulin signaling, causing it to cause the chronic disease, like I've shown you right in the first few slides of the session. So this is what happens. If you have high saturated fat, which I just spoke to you about, which is basically refined oils, which are trans fatty acids, you get direct inflammation. It is a direct cause of inflammation. Now, what do trans fatty acids do? Trans fatty acids go and block the pathways through which nutrition, that's proteins, amino acids, enter your cell, giving it the vital food that the cell requires to survive. What the trans fatty acids does, the oil that you use, especially the refined oil that you're using, it goes and blocks this, right? So this leads to direct inflammation. Also leading to direct inflammation is the decrease in the amount of omega-3 fatty acids in your diet. So this is the fat that should have been high in your diet. Omega-3 is less, omega-6 is high. Why does this happen? For those of us who eat red meat, generally we eat meats, especially in the West, we eat meats from farms. Now the normal food of the animal is grass, not corn. So in the muscle of those animals, the omega-3, omega-6 ratio changes. And this is, instead of 1:2, where omega is 1 and omega-6 is 2, which is anti-inflammatory, omega-3, omega-6 becomes 1:16 or 1:25, which is inflammatory. So the omega-6 goes up drastically. That causes inflammation. Also, the omega-6 goes up because of the kind of oils that we have. A lot of the refined oils contain omega-6, which, when you take in large quantities, causes inflammation. Then you have the oxidative stress because you don't have too much of antioxidants in your food. Why don't you have it? Because you don't have fresh foods. I remember showing you last week how your veggies and fruits, specifically fruits, plucked raw, do not have any nutrition because the nutrition comes in their ripening phase. But most of your fruits come from all over the world. It has to be plucked in the raw phase and brought. Therefore, it is important and imperative that you have locally grown food, locally grown veggies, locally grown fruits, because these will give you the antioxidants, the minerals, the vitamins from the soil, which will then work on the oxidative stress that your body is facing and downplay that oxidative stress. But the amount of antioxidants in our food has gone down drastically, allowing the oxidative stress to merrily play its part and create a huge problem for you, for the insulin signaling and for your health outcomes. This then results in higher glycemic load. Why? Because most of your food today is heavy on carbohydrates, specifically in India. This, unfortunately, is not our fault. It was a fault of the West, where they put this on us, and even of the medical establishment for quite some time now, where we said our carbs should be 60% of our diet. That's the biggest untruth that has caused this whole epidemic of diabetes and a metabolic syndrome to take place. You need to reduce your carbs because the high carbs cause you high glycemia in your body, leading to high blood sugar. leading to insulin signaling as well, impaired insulin signaling as well. And they increase the amount of triglycerides. Triglycerides or cholesterol doesn't go up because of the oil that you eat. It goes up because you eat a lot of carbs. Because when you have too much of glucose, glucose then gets stored in as triglycerides in your liver. Liver converts this glucose into triglycerides. And from the triglycerides, you have LDL, VLDL, and HDL that is formed. And that is what we measure. What we don't measure, which is important, is the LDL, which is the small dense variety, because that is the one that causes you problems. The large fluffy LDL, which is generally present in most of us, is the good cholesterol as well, because the large fluffy LDL takes your cholesterol from the liver where it is made to the site where it is supposed to work. Without cholesterol, my dear friends, we'll be dead. But we need the good variety. We don't need the small dense LDL, which gets oxidized fast and causes all the problems. Yeah. The last food that we don't even realize that we eat regularly is fructose. Now, I want to talk about this. I spoke about it last time. I'm just going to briefly talk about it again. Fructose is present in most fruits, so you can't abundantly eat as much of fruits as you want. That fructose, unlike glucose, is not used up. It goes to the liver and causes fatty liver, causes triglycerides, causes non-alcoholic liver disease, and causes metabolic syndrome and impaired insulin signaling. Also, every sauce that you have in the market has got high corn fructose syrup. Every packaged juice that you have, which has very boldly written no added sugar, which you think is safe for you, has got high corn fructose syrup, which is far worse than having 3 tablespoons of sugar. Please understand this. So you need to get all these off your diet, because all these are causing insulin signaling. All this is causing inflammation. All this is causing the oxidative stress, leading to high blood sugar, leading to diabetes, leading to obesity, leading to heart disease. This is the food pillar that you need to correct. And I've given you the bare minimum. Last week, we spent an hour on the entire food chain and what we need to eat and how we need to eat and what we need to do. Now, when you actually look at this nutrition, the increased risks are of saturated and trans fats, high amounts of carbohydrates, lack of proper fruits. Too much of fruits can also cause problems, and proper vegetables and omega-3s, and excess of omega-6. When you want to reduce your risks, eat fruits, but from the local area, and veggies from the local area. Your food has to be high in omega-3, lots of fish. You can also supplement your omega-3. Try and cut down your carbs to less than 30% of your entire diet, and that should be mainly complex carbs, basically vegetables, and preferably go for what is known as a Mediterranean diet. And let me explain to you some of the benefits. Again, I have put down on the side where I have picked up all these numbers from. This is documented proof that this works. What I'm speaking to you doesn't come from Dr. Lenny's mind or from my imagination. This works. There is enough and more clinical trials to show you. The clinical intervention trials show you that if you try this kind of a diet, which I've just spoken to you of, you have a 70% decrease in heart disease, heart attacks, and all-cause mortality due to cardiac deaths. You have 60% decrease in cardiac events in cardiovascular disease patients, 50% decrease in metabolic syndrome, my dear friends, 38% decrease in inflammatory markers like CRP, decreased insulin resistance and decreased weight. This is already shown in clinical intervention studies. Prospective observation studies also show you that there's a decrease of 80% in diabetes when you follow this kind of a diet. 31% decrease in all-cause cardiovascular mortality, 20% decrease in cancer mortality, 73% decrease in Alzheimer's mortality, 25 to 30% decrease in Parkinson's disease, and 78% decrease in childhood asthma and maternal disease in maternal diet. So you can imagine the kind of benefits you have when you move to this kind of diet. Now let's look at the toxic chemicals. So we've spoken about air pollution, we've spoken about some of the metals, and I'm going to get into a little bit of detail here so you understand why this is bad and how you can get rid of the metals and these endocrine disruptors that affect your body, the bisphenol A and all the others. So let's look at it. So you have already seen the food, which is in red. Now look at what's in the dark color. You have lead and heavy metals, which cause direct inflammation. You have pesticides that affect insulin signaling, giving rise to oxidative stress and inflammation. You have air pollution giving rise to insulin signaling and inflammation together. And you have the endocrine disruptors directly causing obesity, which then causes inflammation. It also disrupts insulin signaling. And you have and you have inactivity, that's a sedentary lifestyle, which causes inflammation as well. So you have the entire conundrum of what you can do to avoid this. You cut off all these one by one, and you restore your health. It's as simple as that. And the diets I've told you, I'm going to give you some of the pointers here. You have some take-home messages. Here's the first ones: endocrine disruptors. What are endocrine disruptors? I told you this. They go and affect your endocrine glands that release hormones. Now, the hormones are chemical messengers that control your body functions. If your body has to function, your endocrine system has to be at its best. If you don't want to age, you don't want your body to age, your endocrine system has to be functioning as if as it was functioning at the age of 25. That is what we do in anti-aging work. We try and get your hormone levels to 25, so your body starts remaining, your body age goes back to 25. It's only the endocrines and the hormones that can do this. So you have something known as a neuroendocrine axis that regulates this. Now, if this is affected, you have a whole lot of problems that start very early on in life for you. And today, if you have people dying of heart disease very early in life, having diabetes at 30, having menopause at 35 or 40, having PCOD, having sterility, pregnancies are delayed, all kinds of issues, including ordinary things like migraines and depression and fibromyalgia, just body pain that you don't know what to do with, because in the West, pain treatment is second only to cardiac treatments. There's so much of pain in our body, all comes from a disrupted endocrine system. And what causes it? I've listed 3 things for you. Your plastic containers and plastic water bottles. Can't we get rid of this? I have. We live in the same country. We can. Avoid Teflon coated pans and cookware. I'm sorry about that mistake. It's and cookware. Now, Teflon contains endocrine disruptors, gets into your food chain, my dear friends. This causes your hormones to get disrupted. It causes decrease in the hormone secretion. It stops the hormone from acting on the sites that it's supposed to act. All kinds of problems it causes. Stop using Teflon, stop using plastics in storage, for water, and for food. And finally, the best way to avoid these in your foods, and what I'm going to talk about next, toxic metals in your food chain, especially in vegetables and fruits, which comes from your pesticides and your inorganic fertilizers, is eat organic food, eat local vegetables, eat local fruits. Now, how would you have organic food then? Simple. Today, I was talking to somebody this morning, and it just reminded me, it said this whole lockdown that we've gone through is such a great time for us to understand that we need to depend on our local veggies, because today all our vegetables comes from out of state. And then you have people who turn around and tell me, it says, Doc, but how can we grow? We live in flats. Well, that's what people live in New York, and that's what people live in London, and that's what people live in Tokyo, and that's what they live in Beijing, and that's what they live in Bombay. And let me tell you, I've got friends who grow their vegetables in their flats, because you have solutions today that you can grow your veggies in your balconies, what are known as hydroponic or aquaponic farms, where the whole farm grows vertical. And you have enough that comes out from there that can take care of your day-to-day requirements. I'm not saying you get to it, but this is something that we need to start thinking about, because this is how we can get organic and local vegetables for ourselves. Got it? So can we type a yes if you resonate with what I'm saying, that this is something that we need to look at? Can we have a few yeses, please? Thank you. Lovely. Thank you. Thank you so much. Thank you. Thank you. Also keeps me motivated to talk, because I know that you are engaged in what I'm saying. So I know I'm troubling you, but I need those responses, as many as you can send me. Yeah. Thank you. Thank you. Yeah. So now let's look at what are the other things that happen. Now, the second most dangerous thing that happens is heavy metals. Now, what are heavy metals? These are elements, metallic elements, that have density and weight 5 times that, atomic weight and density 5 times that of water. There are more than 20 heavy metals, but 4 of them are of particular concern to human health: lead, cadmium, mercury, and arsenic. And I've got some data here for you, so you'll understand how bad it is and how badly it affects our health. These four heavy metals are highly toxic and can cause damaging effects even at very low concentrations. Now, why metals and how are they affecting us? Because the air that we breathe is full of toxic metals, the food that we eat is full of toxic metals, and the groundwater is full of toxic metals. And these are primarily responsible for chronic disease. Unfortunately, we are not paying attention to all of this. Why do I say air is full of it? Because what air are we breathing? We are breathing the same polluted air which has been polluted with your fuels that have been used for your vehicles, which used to, until not too long ago, were basically leaded fuels. Lead is still in the air. As you keep using your lovely tires, which are radial tires today. Earlier we used to have non-radial tires, but now we have radial tires. You release a lot of the cadmium dust in the air because there's cadmium in those tires. Smoking causes cadmium to get into your body. So your food, how does your food get heavy metals? From your inorganic fertilizers. Do you know that India is the dumping ground for arsenic? Large portion of our fertilizers have got arsenic and cadmium in it and mercury in it. Your pesticides that are sprayed on your veggies and on your other food items all have heavy metals in them. These get into the plant. The plant has no form of excretion like a human or an animal. The plant then gets into our bodies, and this does cause problems because those heavy metals get into the body and cause those biochemical reactions, which I'm going to show you in a short while from now. And because of all these fertilizers, your groundwater also gets polluted. Yeah. Besides the fact that we use metal-laden thermometers, sphygmomanometers, the medical profession is not any different. We've got so many mercury sphygmomanometers which we use for your BP apparatuses or checking your BP. So all these, when you don't have a system to get rid of this and you just throw it somewhere in your dustbin, it gets into the groundwater. This groundwater has a lot of mercury. This mercury then enters your food chain, enters your body, and does cause the problems that you see. And we will see what are those problems. Yeah. So one of the ways that your metals actually affect you is very nicely shown. This looks like a very, very heavy diagram or a very complicated diagram. It is not. It's very. If you look at what is in blue above is the normal metabolic process. What's in pink down is metal poisoning or metal toxicity. Now, if you look on the top side, you have zinc sitting on that big circle, Zn. If you look at the top side, that is normal metallofunctional metalloprotein, which takes your minerals to where they're supposed to act in biochemical reactions. This causes the pathways in and out of the cell to remain open. What happens is that same place where zinc was sitting, you see cadmium has come in, CD has come in, it throws the zinc out, and this causes an inhibition of what we call membrane transport processes. So all the food that gets into your cell gets affected. This causes the damage first. Then you have a whole lot of biochemical reactions that are mentioned on the left, which I don't want to get into because it's technical, but this is one of the commonest ways where metals affect you. What do? They go and they occupy the site where a normal mineral is supposed to sit. When that happens, the normal biochemical reaction gets disrupted. And when the normal biochemical reaction gets disrupted, your cell gets sick. And that is the start, the basic start of all chronic disease. This does not happen in a day. This does not happen in 2 days. This keeps happening for a good number of years before you actually start seeing the effect of it. By then, in some cases, it becomes too late for us to reverse. So therefore, today we've got tests that detect this whole issue well in advance. So when we look at preventive cardiology, we look at preventing this position and not getting you heart disease. When we look at preventive oncology, it's preventing you getting cancer. We're looking at these. We have options for this. We have means to do this for you much, much, much beforehand. You can do it by just taking these steps at home, which I just told you. Yeah. Now, to understand how bad this is, I have put in some studies for you. And the first one is the NANS3, where Dr. Alan Silbergeld of the Johns Hopkins University did this study. And and of course, Dr. Mark Klustberg. And they came up with this graph, which is very, very poignant. And I want you to understand this. See, then when they did the study way back in 2000, it was said that the normal levels of lead in your blood could be about 30 micrograms per deciliter. But they found out that at this normal level of lead in your blood, people who had cancer were 68% of the population died of cancer. If the level was at 30, which is supposed to be normal, more than 47 or 48% suffered from cardiovascular disease, and more than 39 to 40% of people died from all-cause mortality. And even if that lead level was halved to 15 instead of 30 micrograms per deciliter, cancer was prevalent in about 46% of the cases, and the all-cause mortality of people with 15 micrograms per deciliter of lead was 17%. So can you imagine? These are figures much higher than any disease that you see in the market. This is what lead does to you. When lead enters your body, this is what happens. This was a study done on the basis of serum, that is blood lead levels, on the basis of the NANS3 in 2000 and published in 2000. So from this, what has happened to this? Yeah. Sorry. From this, they concluded that any amount of lead is bad for you because it's going to cause heart disease, it's going to cause cancer, it's going to cause degenerative disorders, which are generally seen in aging. Now, this was another one that I picked up from 2007. Chronic lead exposure, like I just showed you, gives rise to chronic heart disease, gives rise to peripheral arterial disease, it gives rise to stroke, and more importantly, it gives rise to arrhythmias, hypertension, which is blood pressure, and left ventricular hypertrophy. Of course, that happens when every time you get hypertension. So chronic lead is associated directly with this. There are tons and tons of studies. I don't want to put all of that here. This is not a technical session for doctors. It's for lay people, so I'm not going to get into too much of technicalities, but I just wanted to show you that there is literature in modern medicine that shows you that lead causes heart disease. This is another one that was shown that at a level of less than 2 micrograms, we were talking of 10 micrograms. At a level of just above 2 micrograms, it was noted that people who had high amounts of lead had heart attacks, that's myocardial infarction, MI is myocardial infarction, and strokes. Okay. So how does this affect us? I'm not going to get into this, but you can see the last. I explained to you what endothelial dysfunction is. I told you what inflammation is. Both these affects the arteries, causing you to get those plaque formations, which are responsible for your heart disease or coronary artery disease, for which every one of us has to either go and get ourselves a bypass or an angioplasty. Can be prevented if you get rid of lead from your body, because that is one of those factors that does cause this. Then you have increased oxidative stress. We spoke about what was increased oxidative stress. And I will not get into the others because I don't want to bore you with that, but I just want to mention this autonomic dysregulation affecting heart rate variability. Today, if you have sudden death, it is because your heart rate variability is affected. And anything that affects heart rate variability can give rise to sudden death. So just keep this in mind. Lead in your body affects heart rate variability. Okay. It also causes your serum homocysteine levels to go up. And so a simple test can tell you whether you have high leads in your body, which is causing you to actually have causing the heart disease that is going to finally, which is going to get you to a place where you suffer from heart disease. Now, we in preventive cardiology do look at homocysteine levels. Most modern doctors don't look at it. I don't know why. It's such a simple test to do. Probably the only reason why they don't look at it is because they don't know what to do with it, like they don't know what to do with metabolic syndrome, unfortunately. But we know that this is because of lead. So if you detoxify yourself from lead, yes, you will get this coming down drastically. Now, this is the same NANS3 study which spoke about high blood lead levels causing hypertension, both in men and women. It also spoke about an independent study that was done and reported in Journal of American Medical Association, JAMA, which also said that lead also affects BP or causes BP in men. Now, this is New England Journal of Medicine talking about mercury in fish and increasing the risk of myocardial infarction. So it does go on to explain that mercury may promote atherosclerosis and does increase the risk of myocardial infarction in many ways. It talks about mercury promoting production of free radicals, and it also talks about inactivating the glutathione, catalase, and superoxide dismutase. Now, these are antioxidant pathways that are present in your body, or antioxidants present in your body, super antioxidants present in your body. These are your antioxidant defense mechanism: glutathione, catalase, and superoxide dismutase. Mercury actually blocks them. So this reduces the amount of antioxidant defense that you have, causing oxidation to rise, and this causes disease. And this could be the cause of your myocardial infarction many a times. Yeah. So they found this, that the mercury levels were directly associated with heart attacks. And so they said at the end that we need this whole hypothesis to be tested. Unfortunately, no studies were done despite this being published by such a reputed journal. Now, when you have arsenic in your water, and this was seen in a lot of studies that were done in Bangladesh, but what I have shown you are studies from circulation, hypertension, and stroke, which are publication of the American Heart Association. So you have the reason, the way arsenic affects you: it causes atherosclerosis, it causes high BP, it causes cardiovascular disorders, it causes ischemic heart disease, and it causes peripheral vascular disease. So you can understand now, I've given you three heavy metals that we look at, and these are present in our food chain regularly: lead, arsenic, and mercury. I don't know if I have cadmium here. I should. It also causes menopausal problems. It causes a decreased sex drive, causes early aging and stress. Sorry about that. Yeah, it causes neurological disease and depression and loss of thinking power. And yes, it does cause osteoporosis and hypothyroidism as well. Okay. Now, in diabetes, what I don't have here is a slide on cadmium. Cadmium is directly known to cause diabetes. So if you're smoking, you are actually paying to become a diabetic patient. And therefore, you should avoid it because cigarette smoke has a high amount of cadmium that you take in. Mercury, cadmium is also here, yes, inhibiting magnesium and zinc levels. These cause metabolic syndrome and insulin resistance. So both mercury and cadmium are directly responsible for diabetes. Both are present in most pesticides, and therefore when you use pesticides and you use those fruits in your food, they're going to get affected. So generally, my dear friends, 90% of the times, unfortunately, for an adult, silent symptoms of chronic low-level heavy metal accumulation in tissues can, progress from just a steady decline in energy, productivity, and quality of life to accelerated cardiovascular disease, premature dementia, and total debilitation. What does this mean? It means that when the problem starts, or chronic disease starts, it starts with simple decline in energy. I don't feel like going and doing my morning exercise. Starts with that. That is what goes on to become full-blown heart disease, premature dementia, and total debilitation. All depends whether you can break that cycle and stop the progress of the disease. It's in your hands. So unfortunately, we doctors don't consider this heavy metal burden, and most patients suffer needlessly because we don't even look at this as a cause. Unfortunately, fortunately for me, over the last 15, 20 years, I have been actually looking at this. Just give me a minute. I just want to stop anybody from doing anything on my. Okay. So unfortunately, or fortunately for me, I have been able to look at this for the last 17 years, and I've been able to fortunately treat over 25,000 heart patients using just these principles very, very, very successfully. And I'm grateful for having had this opportunity. Yeah. Now, how do you remove toxins? Probably today we are in such times that our bodies are exposed to more than 50 times the level of toxins than any other time in history. We can get all types of toxins. I've spoken about heavy metals, I've spoken about plastics, I've spoken of bisphenols, I've spoken of endocrine disruptors. You have cell phones that are giving you an amount of electromagnetic radiation that also is not laughable. It kind of causes, the kind of problems it causes is huge. Bowel toxins like candida and other bacterial overgrowth always are present because your immune system goes down. Remember, our human body has got more number of good bacteria in our gut than the number of cells that we have in our entire body. That much of good bacteria we have in our gut. But this gets affected because of the kind of food that we have, resulting in bacterial overgrowth, impaired absorption, and bad nutrients. Then you have acidity, which is probably because of lack of vegetables and the kind of food that we are eating. And I've just spoken about electromagnetic radiation, which affects everything from sperm function, brain waves, thyroid function, and immunity. You have liver toxins because of the kind of medications and prescription drugs we keep taking. Statins, which we use for cholesterol, destroy our liver completely. This further impairs the detoxification process. Normally, the lead, mercury, arsenic, cadmium, all would be thrown out of your body by the liver. But because of the other toxins that we have, like prescription drugs, like alcohol, these then affect the detoxification process. Then you have viruses and fungi that are present almost everywhere, and which again cause a problem for you. And most importantly, heavy metals that need to be removed. Now, you need to, there are a few tips for removing toxins, and this is a major thing that I want you to take home. Avoid plastic bottles, use water bottles and food containers, avoid pesticides, avoid processed food, avoid chlorinated water, avoid gas fumes, avoid medications unnecessarily. Use it for shorter spans of time, not long-term use, unless it is indicated. You need to have seasonal bowel cleanses with good vegetables and supplements containing good probiotics, enzymes and fiber. Colon hydrotherapy is something that we don't have here, so I wouldn't advise you to have it. Removal of heavy toxic metals by chelation therapy and FIR sauna is a must. These are two methods that I use in my clinic, and I could advise them on you, but these two ways you can remove heavy metals and you need to remove them. And then there is another way that we also cleanse the blood of all toxins, and that's called ozone therapy, which is again available in my clinics. A lot of people across the country do it. And if ever you get a chance, you should do it with any clinic close by. Now, how do you remove metals? You remove metals by a process of chelation. This is the best way to do it. When we do chelation, we first check for a detailed history. We look for everything, including immunization and whether you have what is a kind of tableware, any silver-coated foods or any Ayurvedic medications, any amalgams. All this is checked for. Then we have a detailed checklist of what are your symptoms, because many of the symptoms, if not all, are associated with metal toxicity. Then initially we used to do what are known as challenge tests. Today we no longer do them because we can't send these samples to America, and this is where we used to do it at Doctor's Data Lab in the United States. I've done a lot of my patients. I still do them if I have to actually check for patients with autism, or we have to look at patients with any kind of neurological dysfunction like multiple sclerosis and amyotrophic lateral sclerosis, which causes muscle dystrophy to take place. Yeah, so we do that for very specific cases, not for normal heart disease patients or not for prevention patients. Because the blood tests that we do are more than enough to indicate whether you are going down that line. How do you chelate? You have got various chelators, but what we generally use in India is what is known as EDTA and what is known as DMSA, which is a capsule. EDTA is IV. So chelation process is a removal of toxic metals from the body by intravenous chelating agents like EDTA or IV zinc TTPA, which is very difficult to get, and or oral DMSA. I'm just giving you this brief so you understand what it is. Now, EDTA is found to be highly beneficial in treatment of vascular disease, specifically heart disease, atherosclerosis, and this is what I've used for my patients who I've treated of heart disease. It also helps in people who suffer from diabetes. 90% of my diabetics have fantastic outcomes once they start doing chelation. Over the years, their requirement for drugs drops drastically. We also add a whole lot of intervention on the diet as well. Initial course is 30 treatments twice a week, and then we do maintenance of 12 sessions a year, not once a month. Generally, it is done once in a year, 10 to 12 sessions in a month, anytime. Is it safe? It is safer than aspirin. Aspirin has got, lethal dose 50 values are the lethal dose that would require for a rat to die from there. So aspirin 450 milligrams is the lethal dose, EDTA is 1,900. So it's far, far, far safer than even aspirin, yeah, that we take daily. So if it's done properly, you have no issues. The combined action of EDTA, DMSA is fantastic. EDTA normally removes, the combination removes all metals, mercury, nickel, aluminum, lead, everything. The two combined bind cadmium and manganese and remove, and are very useful for neurological disorders like Parkinson's. We use a lot of other things for Parkinson's as well. DMSA detoxifies the central nervous system. EDTA is useful for vascular problems and also detoxifies other organs. This was a study that was done of the chelation that we use for heart disease, because in America, 2 to 3 patients out of every 4 used to opt for chelation. So somebody went to court. Court decided to ask the Congress. Congress went and said, okay, let's give, who put money aside and do a trial. The trial started in 2007, ended in 2012. And this was the results which clearly showed that if you use chelation therapy, and you can see the left, the difference with EDTA chelation was very, very significant. And this was published in 2013. And after that, there are tons of papers published on this. It's fantastic in diabetics. It is great when a person has got an anterior heart attack, and those people do best with this kind of treatment. There are TACT2 and TACT3 that is currently going on to kind of understand the mechanisms of actions a little more in detail, because for the first time in heart disease, a double-blind trial was done to see whether this works or not. Unfortunately, modern cardiology is not willing to accept it because they still want to go ahead and do their surgeries and their surgical intervention, not understanding that this chronic disease is something to do with our lifestyle. And if we remove the toxins associated with it, if we change the food that we eat, if we change the way we exercise, if we change the way we take care of our mind and our body, we will be able to reverse this disease. They don't want to look at it because then no big pharma is going to make money. We are stuck with what we have. Unfortunately, there are certain investigators who have taken this forward and are doing TACT2 and TACT3 with the help of government funds in the US. So hopefully when they come out, we will have this as a mainstream treatment for heart disease. But this virus attack has taught us that many things that what modern medicine does may not be correct, because we still don't understand how this works. When we don't have an answer to treat it till today after 2 months, and we don't know how to prevent it either. Unless we go with what we say, improve your immune system. And to improve your immune system, you need to get rid of oxidation, you need to get rid of inflammation, and you need to ensure that you have normal insulin signaling. So if you can get those pathways in proper order, remove the environmental toxins affecting you, and stop chronic disease, you will improve your immune system. So in conclusion, my dear friends, it's unwise to ignore chronic heavy metal toxicity. Many doctors just turn around and say this is a bunch of crap, it's a myth. No, my dear friends, it is a fact. Chronic heavy metal toxicity forms the very basis of cardiometabolic and many premature aging disorders. Introducing IV detox protocols for ensuring proper detox and reversing disease and restoring health is a path that we all need to consider going forward. Something that you need to look, don't wait for you to get your disease, look at it as a prevention. To ensure that we are not afflicted with scourges of early aging and chronic degeneration, we need to detoxify, rid ourselves of toxic metal load regularly. The best way to detoxify ourselves initially is IV detox, but now we do get many oral chelators and you can use them as well. Thank you.